Sometimes the charge to the patient at the counter isn't just a straightforward, nice, round $15 copay. Any amount that the patient themselves pays is called the out-of-pocket expense. More common these days, plans include deductibles, which can apply to a whole family or individuals. The deductible is a predetermined amount of money that the patient must pay out of pocket before the health plan starts to pay benefits. There can be separate deductibles for medical and pharmacy, or sometimes they can be combined into one. Most deductibles reset once a year, either in January or halfway through the year, so July. Below is an example of a pharmacy deductible that resets in January. If I fill my prescription on January 18th, I must pay the full cost of the medication, in this case $47. On February 2nd, I fill another medication and still pay the full cost, which is $33 for this one. Adding these two together, I get $80 out of pocket. My deductible is $200. So before I am able to have a nice round $15 copay, I must still pay another $120 out of pocket and finish the deductible. There is a difference between co-payments or co-pays and co-insurance. For a copay, the dollar amount that the patient pays out of pocket is always a pre-specified amount, such as $15 copay for routine office visits, $10 copays for Tier 1 generics, and so on. With co-insurance, the amount that the patient pays out of pocket is a percentage of the cost of the service. So if someone pays a 20% co-insurance for medications, then they would pay $15.20 if the cost of the drug is $76. When selling prescriptions, if you didn't know already, you may be surprised to see that there's no tax on them. Taxable and non-taxable items will ultimately vary by what state you're in. The reason behind collecting sales tax on taxable items is to contribute to local government and improve and support activities or projects for the community. In Colorado, prescription drugs are considered non-taxable items. Therefore, if a patient's copay is $15 listed on their insurance card for generic drugs, then the charge at the point of sale will be a flat $15. Here are some examples of items in Colorado that fall into each category. Taxable items include over-the-counter medications, food that is already prepared, clothing, vitamins and supplements, alcohol, and a slew of others. Non-taxable items include prescription medications, groceries, durable medical equipment, drug test kits, and several others.
Today's question: how do deductibles, co-pays, co-insurance, and maximums work? The simple answer is they define the different ways health insurance companies pay most of the costs to keep you healthy. It's a little complicated at first, but not when you understand how everything works together. Your deductible is the amount of your medical costs that you have to pay before your health insurance begins to pay. These amounts can vary dramatically between different plans. Here's an example. Gina has a health plan with a $1,500 deductible. If Gina only has a few little things go wrong during the year that cost less than $1,500 total, she's going to pay the full amount to treat them. However, if Gina has a catastrophic injury or serious illness that requires a lot of medical care to get better, she'll pay her $1,500 deductible, and then her health insurance takes over to pay most, if not all, of her additional covered costs. Often, plans with higher deductibles have lower monthly premiums. The exception to deductibles is preventive care, like annual physical exams and routine gynecological visits with in-network doctors, which are covered by most plans even before meeting a deductible. Sometimes, even after you've met your deductible, you may still have to pay a copay. A copay is a set price that you pay when you visit the doctor, a small portion of the total bill. Copays vary by policy and can change if you see a specialist instead of a regular doctor or seek treatment out of your provider network. Prescription drug coverage may also have copays, which can be higher for specialty medicines and lower for generic drugs. Let's say Gina goes to the doctor with a case of mono. Her doctor charges a $30 copay, and when Gina fills her prescription, she pays a $5 copay to the pharmacy. Her out-of-pocket costs are $35, and her insurance company will reimburse the pharmacy and the doctor for the difference between the copay and the cost of treatment. Some plans have coinsurance, which is the way you and your health insurer share the costs of your care after you've met your deductible. For example, if Gina is injured and she's met her deductible for the year, her health plan will pay 80% of the cost of the rest of her covered expenses, leaving Gina responsible for the remaining 20%. Maximum out-of-pocket is the most you could be responsible for paying for during the plan year for covered expenses. So to sum it up, deductibles are the portion you must pay first before your insurance pays its share. Then you pay only a small portion of your healthcare costs, either a set copay amount or a coinsurance percentage. Maximum out-of-pocket is the most you will pay for covered treatment in 1 year. So now you know.